Hi, I'm Sela.
And I'm Sheen.
And you're now listening to the Google Doks podcast. Hi everyone! Hello sa ating mga listeners from all over the country. I hope na safe tayong lahat and healthy kayo at ang inyong buong family. So we're now on the second episode of a three-part podcast brought to you by the Google Docs. So ngayon, I'm still here. I'm still your host. Hi, I'm Sela.
And I'm Sheena, Sela's co-host. At once again, guys, thank you still na nasa second episode na tayo at kasama pa rin namin kayo. Pero kung kadarating niyo pa lang dito sa second episode, please do check out the first episode. It's uploaded on the same YouTube channel. We discussed there the first topics ng ating self-diagnosis. So, kamusta ka naman, Miss Sela? How are you?
Okay naman ako, Miss Shin. Safe ako. Safe ang aming buong family. Sana kayo rin at ang iyong family is safe.
Safe rin naman kami. Thank you so much. At sana sa lahat ng nakikinig sa atin ay safe. Ayan.
Last week, we talked about the general view of self-diagnosis sa Pilipinas. Ano nga ba yung self-diagnosis? Parang nilatag natin yung facts about this issue kasi nabanggit nga namin last time na ang self-diagnosis ay isang talamak, laganap na issue sa bansa, pero hindi ito nabibigyan ng pansin. Hindi ito sinishare sa pamilya nyo o sa mga kaibigan nyo kasi parte siya ng buhay natin na hindi natin napapansin na nandyan pala siya. But this issue is very alarming kasi it's very dangerous kung hindi natin siya malalabanan at kung hindi natin siya matitigilan. So, last time na pag-usapan yung very, very brief lang introduction about the dangers and the risk na meron ang self-diagnosis. Diba, Machine?
Yes, Miss Sela, super right ka dyan. At last episode nga, na-assess din natin ang ating mga sarili. Katulad nga na sinabi mo, nangyayari siya pero baka hindi natin alam na nangyayari sa atin. That's why we were also introduced doon sa mga possible steps na nagagawa natin. Tapos kung makaka-relate tayo doon sa mga distinguished steps ng self-diagnosis, then that's when we know that we are already self-diagnosing. So guys, be sure to check the first episode too. So ayan, Miss Sela, for today's discussion, excited ka na ba? Kasi ako, for sure, excited na ako.
Siyempre, excited na ako, Mishi, dahil alam kong isa na naman tong napaka-informative na episode na makakatulong para sa ating lahat. So, if you do learn something in this episode, be sure to share it to your friends, to your family, spread the word para lahat tayo ay safe. So, today, Mishi, sino ba ang ating guest?
Yes, once again, Ms. Sela, we are very lucky to be joined today by another esteemed speaker. He finished BS Biology at the University of Santo Tomas in 2006 and Doctor of Medicine at the University of Santo Tomas II in 2011. He finished postgraduate internship at the UP Philippine General Hospital the following year and finished pediatrics residency at the UP Philippine General Hospital in 2015. Right now, he is working as a safety surveillance physician for a medical research organization. Yeah, guys, everybody, Miss Sela, I have the privilege to welcome our speaker for today's episode, Dr. Albert Alcaraz. Hello po, kumusta po kayo?
Hello, Sheena. Hello, Sela. Good afternoon. It's a great opportunity to be here today. Thank you.
Hi po, Docs. No? Sa amin din po, it's a privilege for us to have you in our episode.
Thank you so much.
Alam po namin marami kayong ibabahagi sa aming dalawang machine at sa ating mga listeners from all over the country. Kamusta naman po kayo ngayon, Doc?
Okay naman. I'm staying at home most of the time since my new job requires me to stay at home lang, stay safe. Part-time also, I do online consults. So, yun lang muna sa ako. Nasa bahay lang ako most of the time.
Ayun, buti naman po at we're all staying safe and I hope na lahat din na nakikinig sa atin ay staying safe at iniiwas-iwasan din ang paglabas. So, Miss Sella?
Okay, so ang topic
Yan.
natin for today, ito ay entitled Uncovering Dangers of Self-Diagnosis. So kung last time, parang patikim pa lang yun ng mga dangers or risks na meron ng self-diagnosis. This time, papag-usapan natin siya in a more detailed perspective. Masihimay-himayin natin ngayon ang mga dangers at risks na meron ng self-diagnosis. Diba, Michelle?
Yes, at katulad ng dati guys, we also integrated your questions from the survey. At once again, tayo ay very lucky kasi maaari silang masagot sa episode na ito. Kung hindi man, we are sure na madidiscuss din yung iba sa kanila sa future nating mga episode. Isa na lang pala yung natitira. So this is the Google Docs podcast episode number 2, Uncovering Dangers of Self-Diagnosis.
Okay, so for the first question, Doc, so nasabi nga natin na very talamak ang self-diagnosis sa Pilipinas, so sa bansa natin. Ano po ba yung mga examples ng mga medical conditions, yung mga pinaka-common na self-diagnose ng mga tao sa kanilang mga sarili?
Okay, Rosella. So I'm sure a little review lang ng konti, di ba, with self-diagnosis kasi it is the process of diagnosing yourself with and other medical conditions with the use of alternate resources such as books, internet, past experiences, or even yung mga recommendations or testimonials ng family members. So dahil dyan, what happens is that people sometimes do not seek help. And according to my readings, meron akong nakitang tatlong most common na misdiagnosed psychological or medical diseases. First and foremost is infection. According to the journal Pediatrics, more often than not, infection is misdiagnosed and sometimes not given the proper course of action kasi it's very difficult sometimes to understand if it's a viral or a bacterial infection. More often than not, what happens is that people give antibiotics left and right, which is really not what is recommended. So we'll get into that later. According to my readings also, according to the DOH, in 2014, the number one leading cause of morbidity for both male and females are acute respiratory infection. So what does it mean? Sometimes yung mga tao, kapag inuubo sila or nilalagnat sila, sometimes they often mistake it as just a benign entity, pero yun pala, it's something that requires prompt medical attention. So infections are commonly misdiagnosed or self-diagnosed rather by people. Next is depression. Actually, depression is so common worldwide. It affects around 250 to 300 million people worldwide. When we say depression, it is usually the usual fluctuation of moods and short-lived emotional responses or challenges into everyday life. Alarming din kasi in the Philippines alone, in 2015 daw, there was research done showing that around 3.3 million Filipinos were depressive and 3.1 Filipinos have anxiety. So medyo madami yun, di ba? But you also have to think that sometimes kasi with Filipinos, our cultural perceptions play a role. So sometimes parang, hindi, may pinagdadaanan lang yan or meron lang siyang something. So sometimes people forget to really seek help or just self-diagnose when it comes to depression. And lastly, since I am a pediatrician by profession, so ang napansin ko din before, some people also self-diagnose other kids with yung mga merong mga learning disabilities. Ayan, most common na napapansin ko yung autism. In 2020, according to the Center for Disease Control in the US alone, 1 in 54 children is diagnosed with an autism spectrum disorder. So ibig sabihin yung mga may autism, it is a developmental disability that can cause significant social, communication, and behavioral changes. Sometimes yung mga sa Philippines, 'di ba, parang sinasabi, hindi yung anak ko mahiyain lang siya, ganyan. Parang ganon. And they forget to seek help immediately. So yun yung nagiging problem na self-diagnose siya. So again, to recap, tatlo yung na-research ko na most commonly self-diagnose, yung syempre infections, tapos yung depression, and yung mga developmental disorders.
Okay po, no? So, napansin ko nga rin po na, ayun nga, yung depression tsaka yung developmental disorders ay madalas parang pinagkikibit-balikat lang ng mga Pilipino, no? Kasi parang hindi naman nila nakikita dahil hindi siya nagmamanifest sa physical health ay hindi siya napapansin masyado.
And most people, like what I've said earlier,
Yes.
it's really sort of a cultural thing. Kasi parang, for example, yung mga bata sa school, parang may expectations tayo na the kids would, at 6 or 7 years old, would go to grade 1, di ba? I mean, si Sela, magka-school kami niyan sa Bulacan. So parang, di ba,
Opo.
parang achievement yun na yung parent, parang nakikita na nagtatransition yung uniform yung mga anak nila. And yet, parang if a kid or two is left behind, parang yung feeling nila na parang meron silang kinakahiya or parang merong sense na parang nagkulang ba yung parents sa pagpapalaki ng anak, which is wrong. Kasi for example, yung autism spectrum disorder, it's a spectrum. So ibig sabihin, madami siyang disease entities in between. So para siyang colors of the rainbow. So madami siyang variety and such. So ibig sabihin, madami rin siyang causes. Hindi lang siya basta because of lack of intellectual stimulation, pwedeng genetics din, among other things. So, madami talaga.
Yes po, at itong mga nasabing examples, ito yung talagang pinaka-inspiration kung bakit we thought of self-diagnosis na topic, na mag-raise awareness about the topic in the first place. Kasi sobrang casual na gagamit yung mga terms to describe parang a fleeting phenomena on a personal level. Pero hindi natin masyado nare-realize na meron pa silang mas seryosong implication. So in the spirit po, Doc, no, nung uncovering the dangers of self-diagnosis, we also want to know more about the actual harmful effects naman. Kung halimbawa nag-self-diagnose na tayo, right? Ano naman yung parang pinaka-harmful effects ng self-diagnosis in both our physical and mental health?
Well, actually, if you self-diagnose, essentially, you are assuming that you know the entity that you're dealing with and the other sub-entities that it concerns. So, syempre, if you're not medically trained to do that, then you might miss a step, and it will be difficult for you to diagnose or to treat the appropriate diagnosis or disease. For example, going back dun sa example ko sa mga developmental disorders, sa Philippines, yung mga pediatricians, we recommend developmental screening of children every well baby visit. So pag 9 months, 18 months, 30 months, ayan, check namin sila kung nagagawa ba nila yung normal nila. And then for example, may dumating na batang 2 years old. So ang batang 2 years old ay kaya niya magsabi ng at least 2 words, can follow simple commands. So yung mga ganung bagay, kapag hindi niya nagagawa yon, medyo red flag yun sa'yo. So you have to be very judicious in checking the child. So para maiwasan natin na magkaroon siya ng further problems. Kasi kung halimbawa meron kang delay in 2 or more domains of your development, magiging global developmental delay na siya. So yung mga ganung bata, we provide special support for them. They undergo occupational therapy. Tapos we closely monitor them. So hindi siya yung parang hahayaan mo lang siyang mag-mix dun sa ibang kids. Parang ganon. So that might actually pose more problem. Another classical example, yung mga psychiatric symptoms. Minsan parang pag may nakikita tayo na parang mga, let's say may personality changes or behavioral changes, parang sinasabi nung karaniwang to, uy, nababaliw lang yan, dali niyo siya sa mental, ganyan. Parang ganon agad yung, diba, yung misconception ng mga tao. However, it's very important to eliminate first all the medical causes of personality changes that could actually be a treatable one as well. For example, baka mamaya ang dahilan pa ng kanyang psychiatric problem is, for example, a brain tumor, especially kung meron siyang tumor sa frontal or temporal area niya. So that could lead to personality changes. Tapos, for example, ito, classic example to. Parang, what do you call this? Alam niyo yung movie na Emily Rose? The Exorcism of Emily Rose?
Parang narinig ko na po, pero hindi ko po ata napanood.
Sobrang scary noon kasi parang it's about a girl na parang na-possess daw siya basically. So na-exercise siya, pero eventually she died. Parang ganon. Tapos parang she was like speaking in tongues, among other things. Very religious daw na girl daw tong si Emily Rose. Pero apparently, parang years after, parang when, research and everything would come into light, parang naisip nila na yung manifestation niya is very similar to an encephalitis. So when we say an encephalitis, it's an inflammation of the brain. It could be from anything, from autoimmune. Yung sa kanya parang autoimmune encephalitis siya, NMDA receptor antagonist. So may parang certain mechanisms ng brain mo na nag-haywire because of that. So, pag yung mga ganong encephalitis, of course, meron kang ma-offer na medical treatment, di ba? Tapos kung nagsi-seizure din siya, meron ka ding mabibigay na medical treatment for that. Ang difference lang kasi parang yung mga tao before, siguro, agad, exercise agad yan, parang ganon. Di ba? So, parang
Opo.
ang harm na nangyari, namatay siya eventually. So parang ayun, in our everyday life as it is, it's very important that we cover all bases. Kasi when we self-diagnose, parang mahirap siya. As it cannot be, what do you call this? It cannot be just parang one symptom diagnosis. As doctors, we try to put everything into perspective. So pinagsasama-sama namin yun, and then that's when we think of a more appropriate diagnosis. Kaya harmful siya kasi you might be missing out on a very important step. And eventually, if the right treatment would not be given, it could ultimately lead to death. So, kung harmful siya, I would say yes.
So, grabe po yun, no, na parang sa
Ayun.
developmental disorders, no, na pagkabata ka pa lang, hindi yun na-detect ng maaga. Hanggang sa pagtanda mo, may epekto na siya sa'yo, no? Yung
Exactly.
self-diagnosis.
Actually, you have to monitor them closely. Kasi sometimes, syempre, although we have this certain, may range naman siya though, but syempre, you have to be very watchful about it. So, yun, binabantayan namin talaga yun kung ano yung mga batang nagagawa nila. For example, a 3-year-old kid, dapat marunong na siya magpakilala ng sarili niya. Hi, my name is ganyan, I'm a boy or a girl, ganyan. So, parang pag hindi niya nagagawin ng mga 3-4 years old, medyo parang ma-alarm ka na as a parent. Parang hindi siya shy, parang hindi siya mahiyain lang. So, dapat, you take the necessary steps. Kasi you self-diagnose parang ganun.
Totoo. Hindi, I mean, sa advancements ng technology, dapat talaga sumasabay tayo doon. Kasi may mga practices before na hindi na siya valid ngayon kasi delikado na siya, kagaya nga nung kay Emily Rose. Parang akala natin there's something wrong with her faith or there's something wrong with her spirituality. But in fact, there's something wrong with her body.
Yeah, it's something na medically. So, ganun talaga, you have to rule out first any medical or or organic cause of the personality change prior to ruling out for example, para naman makarelate tayo sa age group natin. Age group natin talaga no? For example, yung mga teenagers and young adults. So ano ba yung common naman sa age group nila? Substance abuse. So syempre, of course, anyone who is under influence of such prohibited drugs would have certain personality changes din na expected. So ayun, syempre, kailangan mo nang ma-rule out yun. Kaya nga, di ba, yung mga, let's say, yung mga ibang nababangga or na-involve sa crime, drug test sila, right? So, it's all a part of it. Para naman malaman kung meron siyang any, organic cause.
Yeah, so, kailangan talaga natin maging wary. So, halimbawa dun nga sa mga problems ng children, as guardians, maging wary sa mga manifestations sa ating physical health. Kasi we may label it another. Pero yun pala, mas seryoso siya. Pati na rin yung, talagang naano ako dun sa case ni Emily Rose. Namula ang aking mga, dapat mamula. So, ayun.
Oh, parang look, in hindsight daw, parang encephalitis like siya. So, di ba? Sorry to add lang kasi parang since we're on the topic na sa age group na natin, so harmful effect, for example, when you diagnose depression, kasi parang when you say depression kasi it has to be according to the DSM-5 criteria. So ito talaga yung criteria na sinusunod for a major depressive episode. Talagang kailangan at least 2 weeks siya. Tapos mapapansin mo na parang depressed siya everyday, yung may feeling siya of helplessness, hopelessness, ganyan. Tapos hindi nakakatulog, ganyan. May significant weight loss, pero hindi naman siya nagda-diet, or weight gain, tapos parang feeling niya fatigue siya or feeling of worthlessness everyday. Yung mga ganun, kasi parang pag yun, nag-fit siya to a certain criteria, then that would be the time you can say, baka meron siyang major depressive episode. But then again, only a trained professional, only a trained psychiatrist or psychologist would be the one appropriate to address that. Hindi yung parang mag-assume ko lang na may depression ka. And then, di ba, it's difficult kasi it's a multifaceted treatment. So madami siyang kailangan gawin. So kung harmful siya, yes, kasi you might not be really addressing the problem, or ang malaking question doon is, may problem ba talaga, 'di ba? So yun.
Okay, so dahil po nandun na tayo sa harmful effects sa ating physical and mental health, mental well-being, kung sa naman po, relationship with a doctor, sa mga health physicians natin, may epekto po ba ang self-diagnosis sa patient-doctor relationship?
Ayan, good question. Alam mo naman, dahil uso na ngayon ng uso na ngayon ng online, some people kasi find it easier to just go online and search for their symptoms and rather than talking to a doctor. But let me tell you that self-diagnosis undermines the role of a doctor in a person's life. And clearly, it is not, the best way to start a good relationship. To be honest, especially I can speak for myself and yung mga medyo batang doctors like us in our generation, we're very enthusiastic, we are very friendly. And ako, I would make you feel that I am a professional, but at the same time, I can also be this person or a confidant that you can tell me everything. Kasi if you tell me everything that you're feeling, then we can come up to a more accurate diagnosis. So, syempre, what happens is that if you resort to self-diagnosing all the time, ang nangyayari doon, parang yung doctor-patient relationship, hindi siya nagiging transparent. At the same time, it may feel that whenever you see a doctor, it would not be a consultation, but more of like a debate or challenging each other lang. Kasi nga parang you feel that, mas tama yung sa'yo kasi ikaw yung nakahanap ng answer mo for your problem. Where in fact, hindi naman pala siya appropriate for you. So yun, it undermines the role of a doctor-patient relationship. It's sad lang kasi, gaya nga sinabi ko, doctors are very enthusiastic in sharing you all the information that you need. Just have to ask the right questions and, to approach them, of course.
Dito po yung mga cases na pinipilit mo na malala yung sakit mo, pero hindi nga. Tapos nagkakaroon talaga ng malat doon sa physician and patient relationship. Kasi gusto mo exaggerate.
Exactly. Saka for example, syempre yung mga doctors naman, trained naman sila to answer your inquiries. So, alam mo, in med school, share ko lang, in med school, we were taught na parang hindi siya zebras all the time. So, ibig sabihin parang hindi siya rare. You know what I mean? Hindi siya rare disease all the time or hindi siya out of the box every time. So, parang you just have to trust your doctor in the judgment that he or she makes. Pero yun nga, it all starts with you being transparent, with you telling all your symptoms, and then from there you can take off from that. Actually, yung operative word natin dito is trust. If you don't trust your doctor, which is the foundation of every relationship anyway, it would be very difficult for you to arrive at a correct diagnosis din as well. Kasi syempre magtatago ka ng mga little things, di ba? Gaya ngayon yung nangyayari sa COVID response natin, di ba? Parang hindi tayo nagsasabi na parang, meron ka palang nakasama or naka-work na who had COVID, ganyan. So, which makes it more difficult for everyone.
Yes. Parang itong epekto sa relationship ng doctor and patients, parang ito yung isa sa sobrang hindi magandang epekto ng self-diagnosis aside from self-medication. Di ba, Miss Sela?
Totoo, kasi syempre, kagaya nga ng sabi ni Doc, sa lahat naman ng relasyon, kailangan ng trust. At yung self-diagnosis, parang siya yung sumisira sa trust na yun. Kasi nagkakaroon kayo ng miscommunication, hindi kayo nagkakaintindihan. Alam naman natin na ang sinumpaang tungkulin ng mga doktor ay ang magpagaling ng mga tao.
True, ayun nga. So, hindi kasi maiwasan ng mga tao na maging anxious na doon sa mga nararamdaman nila. Kaya, hindi rin maiwasan na ipilit yung kung ano yung na-search nila kasi gusto nilang maging tama. Although, hindi naman sila mapapanatag. Kaya, this leads us to our next question. And it is also po from the survey that we disseminated. So, ang tanong nila, normal daw bang maging anxious over the tiniest symptoms that they are experiencing? At siya lang daw ba? Am I the only one doing this or are there others?
Ayan. So, syempre, anxiety, hello, we're human beings, experiencing occasional anxiety is a normal part of life. However, what happens is that if these anxieties become intense, excessive, persistent, to a point that you fear about everyday situations or sometimes it leads to panic attacks, ayan, yun naman na yung hindi maganda. So again, it is important for you to feel that way. I-acknowledge natin yun. But at the same time, we get the correct answers from our experts. So pag meron kang nafe-feel na alam mo na only a doctor could really address, then you should always seek the right help. Yun naman yung importante doon. So kung anxiety lang per se, yes, it's normal. We all experience it every day. Pero you have to seek professional help.
Totoo po yun, no? So, ang anxiety, kapag persistent, ay mas malaki yung nagiging negative effect niya sa ating katawan, sa ating mental and physical health. So, thank you po, Doc, sa pagsagot ng ating survey question. So, for our listeners, if you have questions that you wanted to be addressed sa Google Docs, you may always reach us or may always contact us in our social media accounts. For Facebook, we have www.facebook.com/The Google Docs Podcast. For YouTube naman, Machine.
Yes, Miss Ella, for YouTube, you can always search the Google Docs. Once again, it's the Google space DOKS. The Google Docs, so all episodes will be uploaded there. Actually, the first episode is already uploaded. Please check it out and please stay with us sa episode na to until the very end and until the last episodes, which will come very soon. So thank you so much, guys, for all your support. Ayan, so tayo magbabalik sa ating discussion. So far, Miss Sela, ikaw ba? Kasi ako sobrang dami kong natutunan. Sobrang intense ng ating discussion. Simula pa kanina sa first question hanggang ngayon. And I'm so glad that we did this dahil sobrang daming information na practical na magagamit natin at maitutulong natin sa iba.
Totoo, Machine. Kumbaga lahat ng age group, no? Lahat ng posibleng maranasan ng ating mga listeners dyan, kahit anong edad pa kayo, lahat kayo ay pwedeng makarelate sa ating discussion.
So, ano yun nga po, Doc Al. Naalala ko rin, Miss Ella, no, nung discussion natin ng first episode, meron ding nabanggit si Miss Tay, yung ating first speaker, na parang encourage daw na i-self-diagnose ng mga pasyente yung UTI para daling i-communicate nga when we actually consult our physicians. Pero ngayon we want to delve or we want to discuss it more dito. Kasi minsan daw may mga nabasa din ako na may konting advantages or merong advantages din ang self-diagnosis. Pero bago natin pag-usapan yung mga advantages na yun, meron po ba, Doc Albert, ng mga parang specific illnesses or diseases na safely pwedeng ma-self-diagnose ng mga tao kahit hindi sila professional or medically trained?
Well, actually, ang magiging sagot ko dyan, siguro kung hindi ako medical professional, I would answer yes. Parang, sabihin ko na parang, meron mga sakit na okay lang, ganyan-ganyan. But I would say, the answer to that question would be situational. Kasi, for example, meron kang, sa age group na lang ulit natin. So, for example, meron kang female friend na meron siyang mga pimple sa face. Minsan may pimple siya sa buong katawan. And yet, parang kapag kung siya lang yon, sinelf-diagnose niya, pimples lang to. I should put this on my face, ganyan. It will all be gone. Pero she forgot to look at the bigger picture. Medyo she's gaining weight, medyo hairy siya, at irregular yung menses niya. So, nakalimutan niya yung ibang aspects na yon na kasabay ng paglabas ng pimples niya. That could be a syndrome. So, pwede siya maging polycystic ovarian syndrome, and that could pose some infertility problems later on in life. So, kailangan niya magpatingin sa OB-GYN kasi maybe she can give the OB-GYN can give an intervention that's really would address everything else, not just the pimples alone. So, to go back to your question, kung meron siyang illnesses that may be safely diagnosed, siguro situational. Parang pwede mo ma-diagnose yung pimples, fine. Pero kasi kailangan mo ng help ng professional to look at a bigger picture of everything that's happening. For example, ngayon, with our COVID situation, syempre it's kind of scary din na parang, ano lang to, regular flu, ganyan. Although may guidelines naman kung ano yung difference ni COVID and not, di ba? Kasi nawawalan ka ng sense of smell, ganyan. Or at saka sense of taste. Pero then again, walang same person that would have the same illness or the same manifestations. So basically, may hirap talaga siya, masasabi mo na parang meron kang any disease na madadiagnose mo safely. So I would say pag ito, ang sagot ko dito will be situational. Parang perhaps, pero mas maganda pa din na magpatingin ka talaga sa doktor.
Minsan po, baka tsamba lang na, uy, tama yung nainom kong gamot or tama yung naisip ko na kondisyon ng katawan ko. Pero hindi lahat ng pagkakataon na matatsambahan mo kung ano man yung kondisyon na meron ka.
Exactly. Saka
Unless
yun nga, like, ay sorry,
Opo.
Grosella. Sabi ko nga din, ang importante, you look at the bigger picture of of everything. Hindi yung parang yung treatment kasi hindi tayo parang tapal treatment. You know what I mean? Parang ayan. Dahil hindi tayo ganoon. We are very diligent. So we try to look into everything kasi. So important 'yun.
Dok, paano po yung mga common cold? Pag po ba ubo, sipon, like kaya naman siyang ma-self-diagnose?
Pwede naman, Pwede naman kasi sabihin mo na parang, mukhang regular ubo sipon lang. Pero minsan kasi, yung especially ubo, summertime ngayon, mapapaisip ka, baka it's something else, baka allergic symptom siya. Baka uso kasi allergic rhinitis pag summer, diba? With all the dust and the pollen
Opo.
and the weather changes. So, syempre, iba yung gamot sa ubo, iba yung gamot sa ubo na brought about by a viral illness, iba yung gamot na ubo na brought about by an allergic problem. So, syempre, magkaiba yun. And then, what do you call this? Siguro, pwede mo siyang ma-diagnose kung to be honest, pwede ka na mag-diagnose kung nag-seek ka na ng help before. And the second time around, you encounter the same pattern, ganyan. So, maybe that's the only time you can safely self-diagnose it. Pero at the onset, especially if it's a new, out of the ordinary, you have to always seek professional help.
So, dapat po talaga observation muna, no? Like, if symptoms persist, yun nga po sabi sa mga commercial, na if symptoms persist, consult a doctor.
Exactly. And naalala ko lang pala, magbibigay pa ako ng isang example na makaka-relate yung age group natin. Again, headache. Di ba common yung mga headaches?
Opo, lalo pag stress sa akad.
Yan, di ba? Nakaka-stress yan nag-aaral. I mean, I cannot imagine. Alam mo guys, kahit bayaran nyo ako, hindi na ako babalik ng college. Ayoko na. Kasi sobrang hirap nung ginagawa nyo ngayon. It's online and everything. More fast-paced, di ba? Ang hirap niya. But, I'm trying to say na mahirap siya. So, okay lang na once in a while, sumasakit yung ulo mo na parang on a scale of 1 to 10, mga 3 or 4, kasi like ka nakatapat sa computer, tapos na-anxious ka sa mga professors mo, ganyan. Okay lang naman yun, it happens a lot. Di ba? It happens to everyone. Pero kung halimbawa, bigla ka nagkaroon ng headache na sobrang sakit, na tipong 11 out of 10, and at the same time, yung nagdilim yung paningin mo, nawalan ka ng malay, tapos uminom ka na ng gamot, hindi pa rin nawawala. Diba? You cannot self-diagnose that. It's very out of the usual severity or characteristic. So yun, kailangan mong patingin sa doctor yung mga ganung scenario.
Opo, no. Talagang kapag may out of ordinary sa ating mga listeners dyan, kapag meron kayo naramdaman kakaiba sa katawan nyo, don't hesitate to consult a doctor kasi syempre we want to be safe naman and we want to protect our physical health. So, in line with that question po, Doc, so kayo po ba, masasabi niyo po bang meron po bang mga advantages ang self-diagnosis? Ang practice na ito ay meron bang maidudulot na maganda sa ating buhay or wala po?
Actually, I've been reading a lot with the self-diagnosis. Actually, meron akong nakita mga research sa US, pero mga luma na to, mga 2014, 2015 pa. Ito kasing trend ngayon ng self-diagnosis. It's mainly brought up, at least for the US, it's mainly brought about by two reasons. One, they want to seek faster professional help. So gusto nila mas mabilis, advantage yun for them. And pangalawa, for those people who cannot afford to pay. Kasi di ba sa US, hindi naman lahat, at least nung time na yon, covered ng health insurance nila, di ba? Self-diagnosing via the internet offered them a certain advantage. However, sabi ko nga sa'yo, ang problema kasi sa self-diagnosis, especially for the non-medical people, hindi sila trained to look into the bigger picture. So you might miss an important symptom or sign that could spell a matter of life and death to to some patient or even to yourself. So, kung advantage, siguro yun yung nabanggit ko, advantage siya for people who really want fast information. Kumbaga, ma-answer lang yung question nila. However, it's very important to know, hindi lang importante na fast yung information na makukuha mo. Dapat yung quality and correct information. So, syempre, kung sa Wikipedia ka nag-check, syempre, hindi naman masyadong reliable yun, di ba? Kasi it gets changed from time to time and anybody can just edit what's posted there. So, you have to be looking at reliable websites. For example, yung sa COVID natin, dapat we check on the WHO website, we check on the CDC website, on the DOH website. Yun talagang mga medical organizations who would give you legitimate information.
So, kagaya nga po ng nabanggit nyo, no, sa Philippines din po kasi pansin ko, medyo kulang talaga tayo sa mga healthcare facility. Kaya po siguro talaga talamak ang self-diagnosis, lalo sa mga lugar na wala silang access to proper medication.
I would agree to that. Kaya nga parang lately, well actually matagal naman na, I've been also reading na nauso na yung telemedicine even before this COVID pandemic hit us. Meron ng telemedicine sa Philippines. I think UP yung nag-set up nun even before. Kaya lang syempre, at ginagamit na siya ng mga doctor to the barrios before for if they need specialty consult, ganyan, yun. Pero syempre, like what you said, there is a lack of facilities, actually lack of health workers din kasi 'di ba kulang din yung ratio ng doctors to patients. So, importante din yun na sana ma-address din yung problem na yun. And also, like what I've said earlier, the self-diagnosis, looking back, it's a cultural thing din kasi. So, parang yung mga Pilipino, pag nafe-feel nilang meron silang totoong depression or totoong anxiety, parang may stigma pa din kasi na talagang ayaw nila mag-seek ng help, ayaw nilang humingi ng proper, what do you call this, proper consultation or any appropriate examinations for that. So, yun talaga, stigma din talaga. Di ba sa Philippines din, mataas pa rin, parang, let's not forget, mataas pa rin, rising pa din yung cases natin ng HIV and AIDS, di ba? So, bakit? Kasi some people, una, they lack education on how to protect themselves. And at the same time, meron pa rin stigma, hindi rin sila nagpapatest, where in fact, madali namang magpatest na ngayon, di ba? So, yung mga ganun, cultural thing pa rin talaga sa Pilipino, to be honest. Yung mga ganung bagay.
Okay po. So, more on that, sa mga si Doc Albert ay nagbigay na ng kaunting information, no? Very patikim lang sa ating susunod na episode. So, if you want to know more about ano ba yung mga pwede natin gawin to prevent the practice of self-diagnosis, watch out for the next episode. So, Miss Sheen, ano yung next survey question natin?
Next survey question natin, di ba? Andun na nga tayo sa na cover na natin yung mga advantages o kung meron man, pati na rin yung introduction kung bakit nga meron pa rin nagsa-self-diagnose. So this time, we collected one of the questions from the survey po, and they asked, can self-diagnosis be associated with a placebo effect or nocebo?
Alright, to answer your question, medyo subjective kasi yung placebo versus nocebo effect, right? So it's more of like, sa placebo kasi, what happens is that an intervention is given. So parang in Latin kasi, placebo means I satisfy or I give pleasure. Parang gano'n. So ibig sabihin, parang meron kang nakukuhang effect out of it, pero hindi na-explain yung mechanism on how you get it. Okay? Well, and it gives you good. While on the other end, yung nocebo kasi, it means that I harm. So, kahit naisipin natin nung una na harmless siya, but it can give you something that is really bad or it can backlash, then that's the nocebo effect. I would say, mixture siya ng both. Sabi nga ni, si Sela ba yung nagsabi kanina? Tama ba? Na parang it's a hit or miss. Diba? Pwedeng tumama ka.
Opo.
Makuha mo na, ito yung nangyari sa akin, tama siya. Pero the next time around na it happens to you, baka hindi na siya tama. So I would say it can be both. Pero, wag naman sana tayong umasa doon sa placebo effect lang na parang, okay, gumaling ako, okay na ako. We should not be satisfied with that. Kasi if there's one thing na you would love about the practice of medicine, we would always be able to explain the underlying cause in a very biochemical, anatomical level. Ganun siya kaganda. So, and you would get that kind of response if you seek professional help. So yun yung answer ko doon. It can be both, pero wag naman tayong masatisfy sa lagi lang tayong placebo effect.
So, ayun talaga pagdating sa ating well-being, hindi dapat tayo nag-rely lang sa chance, dun nga sa chamba. Dapat sure, dapat hindi din tayo, tulad nga na sabi ni Doc, hindi tayo nagre-rely sa placebo effect lang. Dapat lagi natin minimake sure na nagko-consult tayo or yung process ng ginagawa natin ay meron talaga siyang basis na hindi by chance lang at hindi lang yung mag-hit tayo ng parang probability lang na kasi hindi natin alam yung mangyayari sa atin kapag nag-miss tayo doon sa ating mga ginagawang pag-diagnose.
Agree.
So, tama nga po yun nga. That's what I like din naman about medical. That's what I like about science. Laging may sagot ang science sa mga nararamdaman natin. And that's what we want for our health din naman. Dapat sure tayo sa lahat ng ating mga ginagawa. Kasi this is our only life and we have to take care of it din. So, Machine?
So, ayun nga, Miss Hella, right? So, thank you so much, Doc Albert, for all the insights that you have shared with us. Sobrang dami naming natutunan. Sobrang ganda. Sobrang saya na nagawa natin tong discussions na to. So, if you have any last words po or any additional information na hindi namin na-cover and hindi natin na-cover sa discussion?
Siguro parting message na lang. I would like to say that, the process of arriving at a correct diagnosis or the clinical reasoning is often mysterious. And you would be surprised how your clinicians do it without much effort kasi nga, they have been trained for it for years. And it would be a good advantage for you if you make the most out of it every time. So, it's okay to read ahead. It's okay to look into online resources, listen to the experiences of our relatives, of our friends, of our family members. It's all okay to do that. But it's very important to filter out those that are beneficial for you. And when you arrive to that moment that you will be talking to your healthcare provider, be sure that there will be transparency and the relationship should be built on trust para maging productive yung inyong consultation. So, we're not saying na self-diagnosis is completely bad. We're saying that the process on how you arrive at a diagnosis might not be the most medically sound. So, that's why you need to seek professional help when it comes to that. So, yun lang naman. I really enjoyed our discussion as well.
Thank you po, Doc. So, meron tayong mga initial knowledge about the symptoms that we experience. Dapat ang approach natin sa pagdating natin sa consultation with a licensed physician, hindi established na ito na yon, kundi confirmation at kung parang questions pa rin. Tapos gusto mo dapat na ma-clarify yung mga questions mong yon at hindi mo dapat sasabihin sa kanya para i-confirm niya sa'yo na ito po ba yun? Tapos hindi mo dapat siya kukontrahin kasi magkakaroon talaga ng further implications nga sa ating health kung ganun ang approach natin sa ating consultations. So, dalhin lang natin yung knowledge na yun para makatulong at maging transparent sa ating mga symptoms na naramdaman. Miss Ella?
Ako din, Nishin. Gusto ko yung napaka-ganda nating na i-point out with the discussion today. Yung fact na, yes, ikaw yung may kilala sa sarili mo. You know what's going on in your body. You know what you're feeling. You know what you're going through. And with that, pwede kang mag-self-diagnose in a way na matutulungan mo yung physician mo for them to accurately say what's happening through your body. Pero dapat talaga ay ginagamit natin tong information na to, binibigyan natin ito sa mga physicians natin kasi with their practice, with their skills, sila lang din naman na makakapagsabi kung ano ba talaga nangyayari sa katawan natin. But also, napaka-importante rin na na-point out na may mga iba't ibang factors kung bakit tayo nagsiself-diagnosis at bakit advantageous siya sa mga ibang tao o sa ibang mga countries. Kasi nga, medyo kulang talaga tayo sa healthcare facilities, pati sa mga healthcare workers na I hope sana with the advancement of technology ay mas matulungan din natin ng mga healthcare professionals sa the medical field.
Ating frontliners. Oo, Miss Sela. And also, yun yung mga takeaway natin sa ating topics, no? Yung mga physical manifestations, hindi dapat natin ini-interpret ng iba on our own. So, yun na talaga yung pinakalundo ng self-diagnosis and why we are raising awareness on this topic.
Yun. So, ayun, maraming salamat nga po ulit sa inyo, Doc Albert, and maraming salamat sa mga listeners natin na umabot sa point na ito.
Yes, thank you so much po sa patuloy na pag-support, guys. Ayan, thank you ulit kay Doc Albert. At yun nga, Miss Ella, no, yung nasabi natin kanina na medyo napatikim na sa atin kung ano yung maririnig natin sa third topic, yung iba niyang social implications. Bakit ba magsha-shine light tayo doon sa mga kaakibat nitong phenomena sa ating society. So ano po ba yung ating third topic, Miss Ella?
So ayun nga, aside from the fact na magde-delve tayo sa mga factors sa bakit nga ba tayo mayroong self-diagnosis practice sa ating country, ipapakita rin natin or iisa-isahin din natin ano ba yung mga websites, mga institutions, or ano yung mga practices para maiwasan natin ng self-diagnosis sa ating day-to-day life. And abangan nyo yon sa ating third episode. So if you want to be informed kung kailan lalabas ang ating third episode, please follow us in our social media accounts. For Facebook, we have www./Google Doc Podcast. For YouTube naman, Machine.
For YouTube, we have the Google Docs. All episodes will be uploaded there. Please make sure to like, share, comment, and subscribe. Let's raise awareness on this topic together.
So before we end this, I just want to say thank you sa inyong lahat and thank you sa pakikinig sa amin ni Machine. Once again, I'm Sela.
And I'm Miss Sheena. And this is the Google Docs Podcast, Episode 2, Uncovering Dangers of Self-Diagnosis.
Join us as we discuss the process on how we can untie ourselves from self-diagnosis and share this so we all experience a learning journey like never before. Thank you, guys.
Thank you, guys. Thank you po so much. Thank you, Doc.